Good morning. This is Professor Maha Shahin. Today we are going to discuss important tips while performing different ophthalmological tests. On the top of these ophthalmological testing is the visual acuity testing. Each eye should be examined separately, meaning that we should test for the visual acuity of the right eye followed by the visual acuity of the left eye. The other eye should be covered properly. Either use the occluder or you may use the patient's own hand. However, it's very important to make the patient cover the other eye firmly with the palm of the hand. Do not let the patient use his fingers to cover the other eye. Otherwise, even on a subconscious level, the patient tends to separate the fingers to be able to see the sign you are asking for. Start with the right eye, then with the left eye. Start with the upper sign on the chart, which is equivalent to visual acuity of 6/60. If the patient could see the upper sign, then move to the second row downwards. And then to the second row till we reach the final row, which is equivalent to 6/6. If the patient could not see the first upper sign properly, then advance 1 meter. The examiner will be at a distance of 5 meters and ask the patient if he could see your fingers. This means that his visual acuity is 5/60. If he couldn't detect your fingers, then advance another meter and so on. Sometimes we may use the pinhole occluder in order to detect the best unaided visual acuity for that patient. Second is the confrontation test. The confrontation test is a rough method to examine the visual field of the patient. Again, each eye should be examined separately. The distance between the patient and the examiner should be 1 meter. Then hold an object, whether your finger, a pen, or pointer, or whatever, in the mid-distance between the examiner and the patient. We compare the visual field of the patient with the visual field of the examiner, meaning that the examiner should have a normal visual field in the start. Move the object from an area outside the limit of the visual field of the examiner and ask the patient to tell you whenever he detects the object. If the examiner detects the object before the patient, this means that there is limitation of the field on this side for the patient. Start from the nasal side of the field, which is the narrowest part of the field. Both heads of the examiner and the patient should be at the same level. Again, please don't forget to examine eye by eye. Do not examine both eyes together. How to examine for the ocular motility? First, the patient looks direct to the examiner and hold an object in a distance about 25 to 30 centimeters in front of the patient. This is the following method for examining the ocular motility. Then ask the patient to look up and left, or direct left, or down and left, down and right, direct right, or upper right. And look if there is any restriction of movement in either eye. Both eyes may be examined together. Another method for examining the ocular motility testing is the command method. In this method, you verbally ask the patient to look to these directions. Light pupillary reflex. Light pupillary reflex is one of the tests that should be done on each eye separately. It should be done in a dark room. At least ask to minimize the room light to the minimum permitted amount. You should separate between both eyes using the patient hands as we see in this slide. Apply the light to the eye and look for the pupillary constriction on this eye, examining the direct pupillary reflex, and for the pupillary constriction in the other eye, examining the consensual reflex. Then repeat the procedure in the other eye. Lid eversion is an important test during ophthalmological examination. It is used for examining the upper palpebral conjunctiva, for follicles or papillae, or in cases of suspected impacted foreign body in the sulcus subtarsalis. Ask the patient to look downward. Apply a cotton-tipped swab or the index finger in a side of the eyelid above the tarsal plate to avoid its firmness. These 2 points are critical for easy eversion of the upper eyelid, which are asking the patient to look downward and using the finger or the swab in a side above the tarsal plate. Then, with the thumb and the index, catch the upper eyelashes and avert the eyelid. The depth of the anterior chamber is an important sign of different ocular disease. It can be estimated roughly using the pen torch. Apply the pen torch from the temporal side of the eye. Use the light to illuminate the eye at the same level of the eye. Look for the distance between the cornea and the iris. This allows for rough estimation for the depth of the anterior chamber. If the anterior chamber is deep, the iris will be fully illuminated. How to stain the cornea? Use fluorescein strips or fluorescein drops. Apply it to the conjunctiva, just 1 or 2 drops. Ask the patient to blink and use the blue light to examine the cornea. Areas that appear green by the blue light are these areas devoid of corneal epithelium. Hirschberg test or corneal light reflex testing is used for screening of strabismus. Use a pen light at a distance of 25 to 30 centimeters from the eye, midway between both eyes. Compare where the light reflex is seen in both corneas. Normally, in erythrophoric patient, the light reflex is seen almost in the center of the pupil and symmetric in both eyes. If it is deviated to a side, then this patient has strabismus. If it is seen on the temporal part of the cornea, so this patient have convergent squint. And if it is seen on the nasal part of the cornea, so this patient has divergent squint. The cover-uncover test is used to detect latent squint. In latent squint, both eyes are orthophoric most of the time. Hence, the corneal light reflex is in the center and symmetrical in both eyes. The complaint of the mother or the patient that the eyes may squint at times such as being tired by the end of the day, during daydreaming, and so on. In order to detect latent squint, we do the cover-uncover test. Cover either eye. The covered eye tends to take its resting position. So the covered eye moves to the squinting position when it is dissociated from its fellow eye. Remove the cover and notice the movement of the previously covered eye. In cases of latent squint, the covered eye will come back from the squinting position to the orthophoric position. Cover test is used in patients with strabismus. Those patients has abnormal corneal reflex test. The light is in the center of the cornea in one eye and is on one side of the cornea in the other eye. The eye with the corneal light reflex in the center is the fixating eye. So we cover the fixating eye, allowing the other eye to take the fixation. Then remove the cover. If the previously squinting eye failed to maintain the fixation it gained after covering the other eye, so this is unilateral squint. And this is the case of the patient seen on the right. But if the previously squinting eye could maintain the fixation it gained after removal of the cover, this means that this is an alternating squint, meaning one eye is fixating and the other eye is squinting and they alternate positions. This is the case of the patient on the left. Regurgitation test is used to examine the patency of the nasolacrimal duct. Squeeze the lacrimal sac against the nasal bones. How to identify the lacrimal sac? The lacrimal sac is just below the medial palpebral ligament. How to identify the medial palpebral ligament? Pull both eyelids outwards, and then on the nasal side, feel the tense medial palpebral ligament. Just below it is the lacrimal sac. Squeeze it against the nasal bones. Use your index finger to squeeze the lacrimal sac. But during squeezing the lacrimal sac, expose as well the lower punctum of the eye. It's very important to be able to see the lower punctum of the eye and to detect if there is fluid or pus coming out of the lower punctum. If there is fluid or pus, then the test is positive, indicating obstruction of the nasolacrimal duct. Corneal reflex is used to test both the fifth and the seventh nerve. The fifth nerve, the trigeminal nerve, is the afferent of the corneal reflex. The seventh nerve, the facial nerve, is the efferent for the corneal reflex. Never anesthetize the eye before doing this test. Otherwise, there is no value of the test. Approach the eye from the side, out of the line of vision of the patient. Distract the patient by talking in any subject such as his complaint. Make all effort that the patient does not see the approaching cotton. Touch the cornea and be sure that you are touching the cornea, not the conjunctiva. Otherwise, this is a conjunctival reflex, not a corneal reflex. Touch the cornea with a strand, very thin strand of clean cotton. Normally, there will be blinking of the eye and lacrimation. Observe for this blinking and lacrimation. How to test for the levator muscle function? This test is needed in cases of ptosis. First, ask the patient to look downward. Put your thumb on the patient's forehead to prevent any brow action or use of the frontalis muscle to elevate the eyelid. Then ask the patient to look upward as far as possible without any change in the head position. The distance the upper lid margin elevates in millimeter is the action of the levator muscle. I hope you find these tips helpful. Thank you for your patience.